Hello all, welcome to RAAONLINE. Myself Dr. Nishantini, Assistant Professor of Pharmacology. So today's class is regarding anti-epileptic drugs, that is the drugs used to treat epilepsy. So this comes under the competency PH 1.19. At the end of this session, you should able to know the types of seizure and types of drugs used to treat seizure, the mechanism of action of those drugs, its dosage, side effects, indication as well as contraindications. So before going in detail, you should know about the definition of these three terminologies, that is epilepsy, seizure and convulsions. So what is a epilepsy? Epilepsy is nothing but a chronic neurological disorder that causes repeated seizure activity. That means it is having a repeated seizure activity. Epilepsy is having repeated seizure activity. Then seizure. What do you mean by seizure? Any excessive or abnormal electrical discharge of neurons with disturbance of consciousness is called seizure. Then comes convulsions. So what do you mean by convulsions? Convulsions means it's a characteristic body movements. Okay, this occurs because of the extensive muscle spasm. Okay, so all the convulsions are seizures, but not all the seizures have convulsion. That is, a seizure may present with convulsion or without convulsion. Okay, so J.H. Jackson, he is an English neurologist. He described epilepsy as a disease of lightning, and he did many research work regarding epilepsy. So before going to see the anti-epileptic drugs, you should know what are the different types of seizure. See, seizure is broadly classified as partial seizure and generalized seizure. Partial seizure means the seizure activity starts in one part of the brain, that is, it involves a particular area of the brain. Whereas generalized seizure means it involves the seizure activity, that is, the abnormal neuronal activity involves the whole brain, that is, both the hemisphere usually involved in generalized seizure. This partial seizure is again classified as simple partial seizure, complex partial seizure and partial seizure with secondary generalization. So in simple partial seizure, the patient is usually conscious or awake. Okay, it involves only a particular part of the body, usually upper or lower limb. The convulsion is restricted to a particular part of the body. Whereas in complex partial seizure, there will be loss of consciousness. Partial seizure with secondary generalization means the seizure activity begins in one area, but it eventually spreads to the whole brain. Next, generalized seizure. This generalized seizure again classified as absence seizure, myoclonic seizure, tonic-clonic seizure and atonic seizure. So let us see in detail about this generalized seizure, which is a common type of seizure disorder. So tonic and clonic seizure, which is otherwise called as major epilepsy or grand mal epilepsy, it is usually called as GTCS. So GTCS is nothing but generalized tonic-clonic seizure. So what is the sequence of this generalized tonic-clonic seizure? Usually the patient will have an aura initially. It is followed by a loud cry, and then the patient become unconscious. He or she may fall in the ground, and it is characterized by the tonic phase. Tonic phase occurs because of the spastic contraction of the muscles. See here, and this tonic phase is followed by clonic jerking of the body movements. Okay, and this is followed by a deep sleep, and then it is again continued to the all the depressive effect of the CNS. Okay. So this is called tonic-clonic seizure. This is absence seizure commonly seen in children, and this absence seizure usually occurs for half a minute, whereas GTCS will occur usually for a period of 1 to 2 minutes. So absence seizure, here the patient is used to stare at a particular place for few seconds. Okay, so it is usually associated with mild jerky movements of the body. Okay, the muscle tone is not much involved in absence seizure. Next is atonic seizure. So what happens is there will be relaxation of all the muscles, so the patient used to fall during this episode. This is called atonic seizure. And myoclonic seizure is nothing but it's a sudden jerky movements of the parts of the body. Now let us see some of the factors that triggers seizures. They are strobe light, that is a bright light, stress, lack of sleep, alcohol, overeating, and some drugs can trigger seizure. Etiology, that is what are the causes of this seizure. It is classified as a primary cause and secondary cause. So the primary cause is usually idiopathic. Idiopathic means the cause is not clearly known. Then secondary causes of seizures include trauma, that is any head injury or any intracranial tumor that can provoke seizure, any intracranial surgery, cerebral ischemia, tuberculoma or cysticercosis. So all these are the secondary cause of seizure. Now we will see about the classification of the anti-epileptic drug. That is, this is basically according to the chemical structure of the drug. This is basically chemical classification of the anti-epileptic drug. So let us see one by one. So barbiturates, which include phenobarbital and primidone. Then comes the hydantoin, which includes phenytoin and fosphenytoin. Aminostilbin, carbamazepine and oxcarbazepine comes under this group. Then ethosuximide, valproic acid, otherwise called as sodium valproate, and divalproic sodium. So this comes under the group called aliphatic carboxylic acid. Then you all know about benzodiazepine. So clonazepam, diazepam, lorazepam and clobazam. These 4 drugs have anti-seizure activity. Then lamotrigine. Then some of the newer drugs are topiramate, zonisamide, levetiracetam, vigabatrin, tiagabine and lacosamide. This GABA analogs called gabapentin and pregabalin also plays an important role in controlling seizures. And this is the another classification of the anticonvulsant drugs based upon the mechanism of action. That is, we can broadly classify according to the action of the drug on ion channels, particularly the sodium channel and the calcium channel. They both are voltage gated channels. And then some drugs acts by increasing the GABA transmission. So you all know that this GABA is a inhibitory neurotransmitter. So by enhancing the level of GABA, the drug produces the anti-epileptic property. So these are the drugs which comes under this group. Next, the drugs which inhibit the excitatory amino acid transmission, that is particularly glutamate. Okay, glutamate is a excitatory neurotransmitter. So these drugs inhibits the glutamate and produces the anti-epileptic effect. So let us see each group in detail.